Hi there, my name is Arifa Tajbai. I'm a pelvic floor physiotherapist.
Hi, my name is Danielle Del Greco and I'm also a pelvic floor physiotherapist and we work at Pelvic Floor Physiotherapy.
So today we're going to be chatting about all the different conditions we see as pelvic floor physiotherapists. I will just do a little brief outline of what the pelvic floor is. So it is a group of muscles that goes between the pubic bone and the coccyx. This is actually looking at it from the top. So it's a sling of muscles and its function is a supportive function. It supports the organs that are inside. It's there for sexual function, and it's also there to make sure that it helps with bladder and bowel control as well. And it's a big part of our core muscles. So, it's quite an important group of muscles. So we'll just be chatting about the dysfunctions that we see.
Yep, so some of the common conditions that we treat as pelvic floor physios are urinary or fecal incontinence. So what that is unwanted leaking of the bladder or the bowel. And sometimes it can be due to tight muscles in the pelvic floor or weak muscles in the pelvic floor. We can also see prolapse, which is when the organs start to descend down into the vaginal canal. And so it may feel like a pressure or a heaviness in the pelvic area. And we also treat a lot of pre and postpartum women for different pain conditions or just problems with delivery and things like that. So I know, Arifa, you've had your own experience with your two kids, so maybe you can tell us a little bit about your experience.
Gosh, well, I've had 2 cesarean sections and in a short gap, both 19 months apart. So yeah, it was a tough time, after giving birth. Things don't feel the same. Your muscles have stretched, and having a cesarean section scar, so there was a lot of tightness there. There was a lot of scar tissue. So luckily I did go for physiotherapy and got that resolved, because even the scar can get quite thickened. You cut through the abdominal, so there's a whole rehab process with that.
That's good.
So yeah, and there's a lot of pain conditions that we do treat.
Yeah. And a lot of it can be due to, again, like just improper form, even core, like how to activate your core properly when you're doing exercises. So we can give a lot of education as well to all types of individuals, men and women, both, for that. So there's also a lot of people don't like to talk about, but pain with intercourse and other pain conditions in the pelvic area that people don't really realize are due to pelvic floor dysfunction. So if you are wondering more about pelvic floor conditions, give us a call and we'll try to help as best as we can. And we offer a 15-minute or 30-minute free consult, so we can also discuss all of it then as well.
So good stuff. Well, we look forward to seeing you.